Welcome to this week's Milton Keynes Council COVID-19 update. In the past 2 weeks, 3,297 people have been tested in Milton Keynes, and of those, 49 people have been found to be positive. The number of cases is currently 9.6 per 100,000 population. For comparison, Luton's current case rate is 13.1 and Bedford's is 11.5 per 100,000. The rate of 9.6 per 100,000 is an increase from last week and continues the trend of small but rising infection rates here in Milton Keynes. While the overall numbers are still low, they are higher than where we would like them to be. So there is no room for complacency. I understand that some people may feel that because the infection rate is low, the danger has passed, or we should just be returning to normal quickly. I therefore want to speak directly to people who do not believe COVID-19 is serious and those who believe we no longer need special measures to deal with the outbreak. The reality is very simple. People are still catching COVID-19. Infection rates are down, but it has not gone away. There is no immunity. The infection rate is being controlled by social distancing and other infection control measures that are in place. The number of deaths and serious cases is low because we've kept the infection rate down. While the overall number of serious cases is small, people should not be willing to take a risk with someone else's life. What if the next serious case was your mum or dad, grandma or granddad, a child with a disability, or a vulnerable adult, or even you? Shops, businesses, the high street, pubs and leisure facilities have only been able to be reopened because people are following the rules. Our economy is depending on that continuing. Our hospital and other NHS services need to be able to return to dealing with people who have other illnesses. They won't be able to do that if people start getting sick again from COVID-19. If more people in the community have COVID-19, there is more risk they will pass it on and cases will rise quickly. This is the way a virus spreads. If that happens quickly, as it has in other places, then the likelihood of local lockdown restrictions being put in place also increases. So the best way to prevent more cases, bring down our infection rate, stop people getting sick and keep our economy open is to follow the COVID-19 prevention measures. They are the new normal and they are not an option. Many are not hard or difficult, while others are more challenging, but we do have to adapt. Wear a mask in most public places, such as in shops and on public transport. Stay 2 meters apart from people if you can. Wash your hands on a regular basis. Do not gather in large indoor groups with more people than you're allowed to. If you have symptoms, stay home and get tested, or if you're asked to do so, by test and trace. You must self-isolate for 10 days from the start of your symptoms or your positive test. Currently, the best and fastest way to access a test is through the drive-through testing facility here in Milton Keynes, which you can book online. While home testing kits are helpful, there is currently a delay in them being dispatched and the processing of the results. Over the next few weeks, we will also be establishing some local testing centres across Milton Keynes, and I will share more details of those soon. We know the vast majority of businesses have worked hard to reopen and are doing the right thing. We don't want them to be undercut by those not willing to follow the rules. We also want to keep people safe at work. Milton Keynes Council has therefore established a single point of contact for people to report concerns about how businesses, venues and workplaces are operating social distancing and other infection control measures. The email address is covidconcern@milton-keynes.gov.uk. Information provided to us is confidential, and while we will follow up the information you provide and assess each report, we won't be able to provide feedback on every individual email. It is down to each and every one of us to keep each other safe from COVID-19. We cannot be complacent or underestimate the impact a second wave of the virus would have on our health and our local economy. We must and need to prevent that happening. If you follow the rules, it will mean less transmission of the virus and our small steps back to normal will continue. If we do not, then returning to normal life will be slower and the impact on our lives of COVID-19 will be greater still. That is what we want to avoid. And by following simple preventative measures, we can. You can. So until next week, stay safe, thank you, and goodbye.